What we've learned over time is that patients who have pain in one part of their body are really very different from patients who have pain throughout their body. And as we've investigated the central neurobiological mechanisms of those phenotypes, we've seen that the brain is actually responding to pain in a different way in the patients who have widespread pain. So then the question becomes, after we learn all of these things that are different in those patients, how can we help a clinician identify them? What we're busy doing now are developing self-report questionnaires that allow that clinician to very quickly get a sense of where the patient falls on that spectrum of centralized pain. What has been really transformative for us is to ask not how much pain, but where the pain is. And when we do that, when we ask people to use, say, a body map and designate on that where they have pain throughout their body, we find that some of the most interesting relationships in terms of response to treatment, response to surgery, and outcomes are related to how widespread that pain is, but also whether or not they have these other comorbid symptoms like fatigue, difficulty sleeping, difficulty concentrating, symptoms of depression. When we take all of that and we put it together into one sort of construct, we find out that that's actually a very useful way of phenotyping patients. While this is, in some ways, a very simple idea, it hasn't been widely applied in the field of chronic pain research.